Pouring and Trimming Diagnostic Casts for removable prosthodontics. Diagnostic casts for complete or removable partial dentures can be fabricated using a two-pore technique, which will prevent the possibility of distortion that can happen when using a single-pore technique where the unset stone-filled impression is inverted onto a patty of unset stone to create a base in one step. In the single-pore inversion technique, unset stone in contact with the impression can flow away from the impression due to gravity or movement during working. If you've seen casts with distorted or thin teeth, this is most likely the cause. This doesn't happen very often, but if you use a very thin mix or move the impression a lot while you're seating it on the patty, it can happen. Remember though, that casts fabricated without inverting the impression during setting will exhibit harder surfaces and greater accuracy. For diagnostic casts, a two-pore technique is preferable. The impression surface is filled with stone, allowed to set, and then a base is added separately later. Disinfect the impression prior to entering the laboratory. Rinse and dry the surface to ensure no pooling of water or disinfectant. Measure the proper proportions of type 3 dental stone and water. Then, either hand mix if the cast will be used for making custom trays, or vacuum mix if the cast will be articulated for diagnostic workup. Vacuum mixing is almost always preferable, producing denser, stronger casts and normally taking much less mixing time. Modulate the speed of pouring stone into the impression as needed. The stone will flow more quickly by increasing the vibrator speed, tilting the impression more steeply, or pressing the tray more firmly onto the vibrator. Flow can be slowed by using the opposite techniques. If teeth are included in the impression, allow a small portion to enter the opening for a tooth, then tilt the impression backwards to halt additional flow into the opening until the initial stone fills the bottom occlusal portion of the impression. Then, increase flow again to fill additional teeth or portions of the impression. Cover all significant anatomy of the impression, including hamular notches, soft palate, retromolar pads, and the full buccal vestibular roll. Ensure the depth of the stone is at least 5 to 10 millimeters thick over the entire surface. Next, use some additional stone and create at least 3 irregularly shaped mounds of stone on top while the stone is still unset. The goal is to create irregular and undercut mounds that will lock onto a base added after the initial stone has set. Otherwise, the base may separate from the anatomical portion of the cast. Wipe off excess stone that has run past the vestibule and might lock around the impression and tray, preventing removal after the setting of the stone. Once the stone is set, trim the peaks of the mounds so the impression in the tray sits horizontal when set upright on the bench top. This will ensure that the base is relatively even in thickness and require minimal trimming. Hand mix type 3 dental stone for a base. First, vibrate a small amount over the entire dampened surface of the first set stone in the tray. Then create a mound of stone in the appropriate shape for the base. Don't just make a round pool of stone, but taper the shape to reflect that of the arch of the impression. Next, take the impression tray and invert it onto the mound. Blend the base stone from the mound to that of the stone that is set in the tray. Make sure to eliminate any voids, unsupported, or thin areas. Separate the alginate impression from the stone cast after 30 to 45 minutes, using as little tilting as possible to minimize the chance of fracturing either lone standing teeth or thin areas of the cast. Immerse the cast in slurry water or soak in tap water for a few minutes to make sure the model stays moist during trimming. This way, debris from the trimmer will not attach to the cast. First, trim the base parallel to the residual ridges using light to moderate pressure. Casts should be a minimum of 12 millimeters or half an inch in the thinnest parts. These are usually the palate and the vestibule. Next, trim the sides of the cast by following the outline of the curvature of the arch. Leave the reflection of the vestibule intact, as you see here on the left of this cast. It is not necessary to create a land area, such as are used on master casts, like you see here on the right. Ensure that no important anatomical structures are trimmed from the cast. Vestibular reflections, hamular notches, tuberosities, and retromolar pads should all be present. This cast is missing part of the tuberosity and the hamular notch because stone did not cover the entire impression. This same thing happened on both sides of this cast. This unacceptable cast has no anterior vestibule. The retromolar pads are missing, and the anterior ridge is unsupported by the base. Proper trimming of diagnostic casts will ensure that they are both accurate and include all anatomical structures. Make sure to trim yours properly.